And Cody, you're first up on the agenda.
Up until Maple Avenue, it's 55. We have people that walk through walls, kids that play on the.
I hate to stop you. Can you use the microphones? Thank you.
Jeff gets me all the time. So, where was I at? 175 minutes. We have a lot of kids that will use the cemetery hill in the winter to sled. Obviously, they're not sledding into the road, but they park along the side there. We have kids and families that walk the county road around dogs. Race weekends, traffic's coming out of town.
So what I'd like you guys to consider is just gradually slowing the speed limit down as you vary the time limits. So it could be 45, 35, 25, 35 to 25. I put just an example on the picture you guys can look at. Obviously, not to scale, probably not exact places, but I think the county highway could handle that a little better. And the other thing I would like you guys to consider is on 1450 West, currently there's 25 miles per hour speed limits signs posted. It's not official in the county ordinance. I would say you guys want that official.
Has there been any accidents or any issues so far?
We had an accident on 1450 West the other day. Didn't have anything to do with speed, but it was the main thing is the speeding and really close the stop sign.
It seems a little excessive, isn't it, at 35 and 45? What's your thoughts there?
I leave that up to you guys. I just think it should be the.
Sure. Yeah.
And the county road goes all the way up to the first stop sign. That's where the road that you were mentioning, right? I was out there earlier, and I know the 25 mile an hour on 450, that's just coming from the south. There's no signage going north, right? On 1450?
Yeah, so there is a 25 mile per hour sign facing north and south.
Yeah, there is one on the north. I did not see that. Okay. Okay. Well, I know I've talked with Gary and Chris. There's hardly any ordinances that control the county's roads in Pulaski County. You know, I can see additional signage on 175, but I don't know adjusting too much on the 125. I mean, every town has, going into Francisville, there's a 30 mile an hour coming in from the east. It appears it's just posting of signs with no ordinances behind it. I don't know, Kevin, do you have any ordinances?
Yes. Since I've been county attorney for the past 10 years, we've passed several. It requires an ordinance by both boards, believe it or not. And I don't know why it's actually what it is. You need to make a written ordinance to specify where the speed limit is. It can be changed.
Right.
This means where you can reduce it from 55. So wherever you decide to do it, I assume these are all, this is county roadway and not the incorporated town area.
Right.
So, and you would, yeah, you just have to say where you want to start. You could define it, and you would be able to enforce it.
Okay.
Or any county officer would.
Discussion or comments?
Well, I kind of agree with Cody that it's probably close to that. I know I had complaints from Medaryville, the town out of their key. He said it was talking about 1450 lower than that speed limit. They fly up and down that road, and then, 175 is where it's coming into town, right? On the north or east-west road, the same thing. So I think Ken's on the right track. I was doing about 35 and 45 sure seemed pretty good to me to start getting people slowed down before they. And then I don't know, Cody, I don't know what you think about the 1450, but there's several houses, I guess, along there.
Yeah, so there's signs posted already, but it's just, it's not
25.
an official county ordinance. It's attorney sign.
So on 1450, we just need to get an ordinance to support the sign that's there.
It's possible people just put up signs, right?
I think you could go from 55 on 1175. I mean, you get to Eric's pasture instead of going to, say you could go, or I don't know. I think Eric's 35 is okay. We'll go back here further and go 45, and like where that star is, starting at 45. So they know to slow down. Because if you get up here at 30, 45 mile an hour, you know how they are there.
Some, it shouldn't go from 55 to 25. I don't agree with that. Like we talked about.
You can settle it down a little bit. They do come in there in the racetrack crowd.
Yeah, they just have some minimum. Well,
But we can let Cody and Gary work out the signage on 175. I think we'd need a motion then to set an ordinance for 1450.
Well, if it's your intention, I'll just have Gary and Cody give you the footage of where they want to start. And we can graph something and circulate it and just post or pass it at the next meetings.
Okay.
Then you need to advertise it for a little while before you make it effective.
I just maybe want to see if you guys can consider. Thank you guys for your
I
time.
don't think you don't really need a motion.
Don't need a motion.
Thank you.
Okay.
Thanks, Cody.
Thank you, Cody.
Okay, Dr. Allman and staff.
Okay. Thank you. Thank you for the opportunity to talk with you this evening about the Governor's Public Health Commission. I was here about, I think, maybe 2 months ago and spoke about the state of the health of Pulaski County and Indiana. I'll review that just very briefly. Across our state, the life expectancy varies by 3 years. From the county with the highest life expectancy, lowest. Businesses look to move into healthy communities. They can have healthy workers. Pulaski County Community Foundation has spoken with our residents, and over the last 3 years, determined that the county residents want a safe, drug-free, and mentally healthy community. There's other studies too, but that are done by like the hospital, so I won't review all those. This year, the Governor Holcomb sponsored Senate Bill 4. Our Senator Charbonneau, was the chairman of the Health Committee, and this was passed. The Governor's Aim was to fund this with state money, state appropriations, not grants. And that money would be used to improve the health of Indiana. Right now, we rank, out of 50 states, we rank 47th as far as how much we spend on our health in our state. So this money, if it's be used only for public health. I've handed some papers out, and you'll see it says funding requirements. You'll see there's another one with the big block on the side. It talks about how you can spend this money. It would start in January of 2024. Their intention and the rules that have been sent out by the State Department of Health, the county will continue to fund it at the same level that they have been funding it. And I've got figures here for the last 4 years, and it averages out about $190,000. State then, if you look at this paper here, you'll see up at the top, we will get at a minimum of $164,000 the first year. This is phased in. And if you opt in, second year, then it's at full funding. It's $328,000 from the state. You add $190,000 each figures. First year, 2024, health funding in Pulaski County would be funded $354,000. Second year, $518,000. They plan for this to be over a 5-year cycle. You opt in, you're in until you tell them you want out. Now, you should ask, well, what if we don't opt in? We're going to be limited to $190,000. My understanding. Won't be getting grants. We can do it the old way, a lot less money. We opt in, have the state appropriation plus county's contribution. If you get the money, where does it have to go? It's an appropriation. It has to go to public health. It can't be spent on bridges or roads, ambulances, things like that. Again, you'll see the things that it can be spent on. Now, if I were you, I'd say, well, aren't they going to pull the plug and then stick us with the funding this forever? No. You can opt out. Is it an unfunded mandate? No. State appropriation. They pull the plug, then you pull the plug. I mean, it's pretty straightforward. So you have options. And then just a couple more details, then I'll stop here so you can entertain questions. Currently, like Terry goes out and does septic inspection, does food inspection, things like that. I'm not supposed to use certain words like enforcement here tonight, but I don't know of a better word. You know, if I let my sewage go into somebody else's yard, somebody's going to come out and force the septic. 40%, a maximum of this money, 40% or less can be spent on those enforcement issues, nasty things, that we do to make sure our neighbors and we stay healthy. At least 60% has to be spent on on programs, the upper half, to make health better, to look for children that have lead poisoning, to make immunizations readily available, to do emergency preparedness, to improve the health of mothers and unborn children in our community. Since we are a OB desert now, we can help them get to a doctor. Trauma, injury prevention, chronic disease prevention, like diabetes, high blood pressure, heart disease. TB control, to reduce that, to make sure that TB patients take their medicine and get cured. Fatality review, to try to reduce deaths from, for example, from overdose. And there's another one for trauma, reduce trauma. Vital statistics, referrals to clinical care for those that need it, we can help them. HIV, testing, counseling, and then 2 more, student health and communicable disease prevention. So those are the 60%. those are the things that don't get much attention right now because we don't have the money. We have to do septic, we have to do wells, we have to do food inspections. Now here's the carrot on the end of this, the carrot on a stick. 10%, up to 10% of this money can be spent on vehicles, rent, buildings. You can save it. You don't have to spend that 10% every year. If you want to save it and, get a nest egg to use, you can 10%. So we anticipate that this would be a 5-year cycle. And they ask us, don't spend all the money the first year, leave some room for inflation. So that year 2 or 3, if it goes out 4 and 5, we have a little bit of, it's not like you have to spend it or you can keep it. Now, if we choose not to do this, they're going to give this money to other counties for public health. It won't go to roads, it won't go to bridges. It will go to another county for public health. So that's why if you look at the local public health funding 24-25, you'll see the maximum 218 from the state, year 1, maximum 437,000 year 2. That's if enough counties don't want it, then they're going to give it to us. So lastly, there's a color map of Indiana. There's 2. One is the health needs assessment. That just tells you how good or bad our county health is. But the one that says opting in, and you'll see, I think, Andrea, I counted there's 11 on there that have already opted in, and 2 are contiguous with us, bordering our county. So that's really it in a nutshell, so I'll stop and take questions. What I'm asking is that our commissioners make a resolution to opt in. What I'm asking.
When you say this is a 5-year cycle, does that mean that they've already said it will go for at least 5 years now? And
Right,
then,
two. 2-year cycle.
okay, so right,
But they anticipate it'll become a 5-year cycle.
okay. Then after 5 years, right now they'd have no anticipation whether it'll continue on after that, or they're just assuming that it will?
I think it's like any government budget. They'll decide we have to show it was spent well,
Right.
accomplished what we wanted. The governor's behind it. Good.
Who would be responsible for overseeing funds?
The health department,
Okay,
twice a year,
okay.
we have to send reports to the state. We understand there's a lot of startup. So the first year they want us to build capacity to hire people that are able to do this. They know we're not going to be full speed, right at the beginning.
Is there any clause there that gives approval to spend? Do you have to come to either one of these boards in order
No.
to spend your funding?
Well, let me say, the county council has the right to stop this. Okay, really at any time. But that'll be the end of it. Because they're going to take the money and give it to somebody else. And the reason this was done was so you don't have to look at everything we spend. State money. That makes sense, just like the courts. Courts get state money. They understand that the counties by themselves also can't fund health departments. They can't keep the wages as high as you'd like to keep. For all the same reasons, it's county money. So this is why the governor turned this around and said state appropriation money will fund local public health if local bodies like you agree to do that.
So do you need buy-in from any, I know under these next steps, you need buy-in from any of these other groups?
Not
Before you
officially, but yes, to be successful. For example, I've talked to the Community Foundation, Leanne Wright. She's moving forward, hopefully with plans for the matching opioid grant, reduce drug and addiction.
Right.
So those, yes, you can see we overlap with lots of people. So definitely we will. And I'm hoping that the sooner, if you do opt in, the resolution, the sooner it's done, the more time we have to begin to connect with these other groups. We can contract too. We don't have to hire, our own people to do everything. Contract. They're asking us to be creative. So.
Other questions?
I would make a motion to move forward with opting in.
So the commissioner side, been moved and seconded. Any other discussion? All in favor, say aye.
Aye.
Opposed?
And they're asking, a resolution could be very simple. Just we opt in as Pulaski County. It doesn't have to be fancy. The only other requirement is that it has to be sent down to the State Department of Health. Thank you.
Sure, our attorney, Mr. Tankersley, will be happy. I'm sure that our attorney, Mr. Tankersley, will be happy to get you something drafted up so it matches our resolution.
Thank you. Andrea has the website down at the Indiana Department of Health. Sent to September 1st, but there's a lot of work to be done here, as you can imagine. Sooner the better.
No, I agree. I think this is the right move.
Somehow I have a sample resolution here. Did it come with my packet or whatever?
You can thank Andrea for that.
I will pass
Yes.
it on to Kevin and make his work very easy. And
Yes,
it's,
seriously,
I think it's a generic one that was sent by the state. And we can certainly just put our own information into this. And maybe we can, we have a meeting next Monday. Can sign the resolution. Okay.
thank you very much.
Thank you.
I appreciate it. I think it's good for Pulaski County and each of you here. Thank you.
Thank you.
I give a farewell. He's retiring Friday.
Sure.
I just want to say thank you. This week is my last week and I'm retiring. And I just want to say I've been through 8 sets of commissioners and council, I think, through the years. I've been here over 32 years. And through the years, we've really appreciated all of the help that the commissioners and council have been to the health department. There's been so many changes through the years, and we've appreciated all of the support that we've had. So I just thank you very much for your continued support of the health department. So thank you and goodbye. So, I appreciate it. Thank you so much.
Thank you so much, Terry, for all you've done for the county. We really appreciate it.
Right. And Raymond? Nathan?
Good evening, everyone. Don't worry, sir. Thank you. I will get through this quickly, I think. Just a couple of updates. On the courthouse project, our architects have moved final phase, preparing construction drawings that will be used by Ton and Blank to solicit bids when the time comes. Kevin and our outside consultants have been working on establishing the building corporation and moving us toward bond issuance, while I've brought the steering committee together a couple of times in the last month, hash out some lingering design-related issues, which I think we've accomplished, with thanks to Sheila for stepping in her first meeting and kind of leading a compromise between two passionately divergent camps on one of the matters that was still to be addressed. We've made a couple of additional walkthroughs of the building with the design team and consultant for some measurement verification and IT and AV planning. moving company will be sending its estimator in the next week or two to go through the building with me so that we can discuss specific needs for moves with each department head to make sure that we have everything lined up to get them over to the East Annex when the time comes. Any questions on the courthouse project at this point?
Do you want to mention anything on the final change order?
Oh, we did approve the final change order on the Justice Center, and that final change order was the one by which Ton and Blank returned $154,000 of their contingency unspent. Unfortunately, working with the sheriff's office, I found ways to help us to get caught up some technology issues that have brought most of that down, but they did end up returning $154,000 in contingency. I was pretty excited to see that come in.
154, 238 and 42 cents.
Thank you. Yes, that is the exact number that they did not spend from their budget. And then another quick update on the housing project. We had another passionate, vigorous discussion at our housing task force meeting about 10 days ago. And after that, we have a plan in place. I need to speak with one landowner about his family's property, and then we'll either have a final commitment to move forward with pre-development on the county farm property south of 60 South, or need to prepare a formal offer to that other property owner. I suspect we'll be proceeding with the county-owned property for both cost effectiveness and timeliness, but we want to exhaust every option before we cross the point of no return. As we are moving forward with pre-development efforts on the Catalyst site with the Housing Resource Hub, we'll also be connecting with owners of one or two properties that are in partial states of development that don't meet the criteria for this catalytic site that we're looking at, but could help to bridge the gap, and we can make some of the assets, the resources that the hub brings to the community available to them to help to fill some more of their lots. I recently attended the Indiana Association of Realtors Rural Housing Summit. It turned out, despite the fact that it came to me through the Indiana Economic Development Association, that was really geared more towards realtors than towards others. But it was a really insightful presentation nonetheless, and I have learned a little bit more about a couple of bills that passed into law in this year's session that may offer us some fiscal relief as we try to make housing development possible without putting too much burden on any one participant in the capital stack, while still trying to keep it as affordable as possible. Any questions? And I've got one other issue primarily for the commissioners I'd like to bring up. A couple of months ago, I think it might have been the most recent joint session, I had brought up the issue of my office's internet. The council approved a transfer for my office budget if we got to the point at which the commissioner said that I could go ahead and contact Lightstream about reconnecting to the fiber at my building. DeGroote Technology finally was able to implement the solution that they thought would improve my office's internet reliability, and thus far it has actually proven to make it less reliable and slower than it had been previously. I've had at least 3 telephone calls I have dropped because we have the internet phone system, and it's just not getting any better. You know, I had been point to point to point, so there was 2 connections across the air. They connected me directly to one of the relays at the courthouse that no longer is necessary for this building now that they're back on fiber, and somehow or another that has actually worsened the service at the office. It's down more frequently. It's slower than it had been when it is live. It's just making conducting business difficult. I don't want to throw a laptop out the window because the internet isn't working again.
What's the next alternative? Any?
Willie said that they would look at it again. I don't know what else there is, though, once they've made that connection, other than reconnecting to Lightstream. The fiber is there, so it would just be the monthly cost. There's no hook, there's not going to be any connection costs necessary. We had it several years ago until our IT department at the time cut it as a cost-saving measure, and I don't know what has happened in the last year that has gotten so bad, because that had been a workable solution for a number of years, but it's just increasingly untenable. I can, if I have to look something up online quickly or send an email, I can use my phone, but if people are trying to reach the office and don't know to call my cell number, like I said, I'm dropping calls regularly now that we have the internet phones.
Guess I did have one question. If we go back to, it's more on the courthouse. I think we received an email about the cost of changing the locks for the building that the clerk is going to be in. Is that done or?
I believe that the clerk has told the company to go ahead and do that,
Go ahead and
yes.
do it. Any other questions for Nathan?
I guess I would, I mean, Nathan, they need internet that works out there. If what they were doing before and what they're doing now is not working, I think we need to, at least for now, until they move into the new office when the courthouse is done, we need to get them the high-speed internet. Got two folk working in the office now, and I just don't see how they conduct business.
So, next step.
I'd say they need to hook back up to the light stream. I mean, if Willie hasn't been able to, and I mean, they're good. I'm sure they've exhausted, all
I can ask him to try one more time, but I like Ken said, I think they're exhausting the options, connecting me without a physical connection. I'll ask him one more time, but if not, if they can't make it work within like the next month, can I just reconnect and stop stopping phone calls? So we're point to point from the courthouse. So the same internet bill for the courthouse and justice center, they just relay the signal to my office. So out of the gig service, I get 9 megabytes down, which is what I was getting at my parents' house in 2001 on dial-up, I think. It's pretty bad.
Okay, anything else? Yeah. I think we.
So ask Willie one more time. If you can't do it, just go get it done. Is that fair?
I would say, yeah, because you need it.
Okay. Thank you.
Okay, the next item of business, the approval of signing joint session minutes. We just have a copy here, so if we would want to table those until they are sent, we can do that at the next meeting.
Okay, I will make a motion to table those.
Moved and seconded, all in favor from the commissioners, say aye. Aye. Ken?
I'll entertain a motion from the council to table signing of the last joint session minutes meeting. I have a motion. Do I have a second? I have a motion and a second. Any further discussion? All in favor, say aye. Opposed? Passes.
Okay, the next item was the Covered Bridge certification. And this is something that is just the commissioners need to sign, that just certificate saying how many covered bridges there are in Pulaski County. So it talks about we, the commissioners of Pulaski County, hereby certify that the affirmation is a true number of covered bridges within the county. And that little number at the top says 0. So we would need a motion to approve this certification from the council, or from the commissioners rather.
Okay, make a motion.
Moved and seconded, all in favor say aye. Aye. And then lastly, employee policy handbook change. And this is some issues that's coming from the auditor's office. They are not pay sales tax. People go to conferences. A lot of times the bill comes back with the sales tax still included. Is that correct, Laura? Want to explain that more?
Everyone is supposed to get a check from the auditor and get the. However, sometimes these conferences, these hotel rooms are paid by a personal credit card. Auditor's office. When that happens, they cannot use the State Board of Accounts said this is council and your travel policy on whether you want to reimburse for taxes that are charged. Credit card. That explains
Yeah, I mean, it's, okay.
Yes, is the standard policy for them to come, for employees to come get a check then from the,
I know one time I actually followed that procedure. I got to the hotel and for whatever reason, they would not accept.
yeah, I guess, I want to make it as simple and as easy for everybody, the auditor's office and the employee go. And there again, I don't want to become a policy that gets abused because now it's easy to just use my credit card and now we're paying taxes on everything when we shouldn't be paying taxes. So, I mean, I don't know if it would, I don't know if like the county had a travel credit card that picked up and used when you travel. Some companies do that. I don't know whether that'd be more trouble than good. Okay, no, I'm.
What if the employee provides an itemized receipt to receive reimbursement? But
Do they know where they're going to stay? And could arrangements be made with that? Yeah. That's how it should be. And if they know what the cost is, you could make the check, they pick it up, they go.
so then Tim, to follow up with your comment, if they do not follow those procedures, and they bring in a receipt, itemized receipt, do we not pay taxes? That's,
You know, that's almost a tough one to say it's 100% clear cut. I mean, we want people to use the procedures that are in place so we get the tax exemption. But there again, if you're at a conference and, I'll use Nathan's example, and you can't get in, you can't go, well, I'm going home now, or I'm going to put it on my credit card, then we're not going to pay them back for their taxes. They're going to pay for the taxes out of their pocket. That would be wrong as well.
What happens if a hotel doesn't allow an invoice prior to your stay? So then you're in that same spot again.
Yeah, I guess I would look at it, we go forward, as we have, we expect everybody to come, go through the auditor's office, present their invoice, get their check prior to going with their tax exemption status. Then, I would agree with what Laura said, if you can't follow that procedure, then should be a document or something that you put with it explaining why you weren't able to follow the procedure, and hate to see people coming in front of the board to justify it each time. But
Do it like if it's above $1 amount, so that you're not
Some.
going in front of the board every single time. So
Right.
if it's under $50, you go ahead and process it, but if it's above $50, they have to come in front of the board.
yeah, that makes sense to me. I don't want every time something happens, come running.
We're not talking about a lot of tax dollars.
Right.
have a motion with. So we need to make a motion then with a limit. Someone want to do that?
Yeah. Yeah, I would agree. We'll approve taxes, up to, $50, and anything over $50, you need to come in and justify it. If we need to adjust that number, we can always adjust it later if we find out that. I know on taxes on a motel room, sometimes my taxes on the motel room are 25% of what I paid for the motel. I mean, you get innkeeper's taxes, you get this tax, that tax, and, it can be, if I'm staying in a room that's $100, it might be $120 when I get the bill. Yeah. Yeah, that's why I'm thinking, 2 nights, I think most of our conferences are a couple of nights, and also, $50 would cover that for you.
So who wants to come up with the language?
But any handbook changes got to be approved by both boards.
Yeah.
Not on the handbook, everything else they do. I can,
After Monday's meeting, we can get together maybe language. We'll, in a week, try and get some language. And
and I'm more than happy to help work with you guys on the language, but
Right.
somebody from the.
anything else from the commissioners? Linda?
No.
Anything else from the council, Ken?
Anything from the council?
Just have two quick, announcements here. If you remember back, this comes from Leanne. During the February joint session meeting, the Pulaski County Drug-Free Council and the Community Foundation requested your permission to apply for this grant and utilize the opioid settlement funds award to the county as the match. And we're very hopeful that tomorrow at 11 a.m. we will get good news on that. So thanks for the grant writing. Appreciate that. And the other thing, broadband equity assess and development BRED program. They're having a conference here in this building on June 21st from 4 to 6. And that is open to all broadband interested parties. So that'll take place here. That's all I have. Make a motion during this session so they can get on with their council.
Yeah, make a motion.
Meeting's adjourned from the commissioners.
All right, council will adjourn their meeting, the joint session meeting.